So heading is ECG. Heading is ECG. And as I told you, we will revise in less than how much time? Less than 3 minutes. You can write into a copy. ECG in less than 3 minutes, I'll do it. So let's start ECG. Let's take first of all, we start from very basics of ECG. Friends, your basics should be very strong. If you really want to go to top of the world, your ECG, your basics should be very strong. So let's talk from ECG paper. The ECG paper is like this. It's like this. Zoom करेंगे इसको जरा. Zoom it. Yeah. Each 1, 2, 3, 4. 1, 2, 3, 4. Each small square is of 1 millimeter by 1 millimeter size. This is time 0.04 second, and this is voltage 1 millivolt. So friend, it is just like a graph paper. ECG paper is just like a graph paper what we have used in our school days. Each small square is of 1 millimeter by 1 millimeter size. Horizontal is time 0.04 second, and the vertical is voltage 1 millivolt. Very basic thing we talk about. So now we talk about the first question which came in this year NEET exam also. Well, this is the one beat, and this is the other beat. The question was calculate the heart rate of this patient. So how to calculate heart rate? Heart rate is equal to 1500 divided by number of small square between two R waves. Look at the screen now. So we have two R waves, 1, 2, 3, 4, 5 small squares are there in this. So the heart rate is divided by 5, 300. So in this recording the heart rate is 300. So friends, how to calculate heart rate? 1500 divided by number of small square between two R wave, 1, 2, 3, 4, 5, 300. So how to calculate heart rate? 1500 divided by number of small squares between RR. This is known as, this is our box number 1. This is our box number 1. All of you make the boxes the way I am making. This is box number 1. How to calculate heart rate. Now we move on to P wave. P wave, this question came in recent, this question came in AIMS exam, May AIMS exam. P wave. The second word is P wave. P wave. Normal P wave. Look at screen now. This is the P wave. The blue one. Blue one. Normal P wave height and width both are less than 2.5 small squares. Height and width both are less than 2.5 small squares. And if you get a P wave like this, tall P wave, if you get a tall P wave, look, width is normal, but height how much tall? 1, 2, 3, 4, 4.5. Tall P wave. So tall P wave is equal to P pulmonale. P pulmonale equal to right atrial enlargement. Right atrial enlargement. Okay, and this is the box number 2. This is the box number 2. Box number 2. And suppose you get a P wave like this. Suppose you get a P wave like this. Like this. It's a wide P wave. Height is normal, but it's a wide P wave. Wide P wave. So wide P wave white P wave is equal to P mitral equal to left atrial enlargement. Left atrial enlargement. This is the box number 3. Box number 3. So we got 2 questions on P wave also. Now we move on to PR interval. I think I can rub it out now. So now we talk about PR interval. Okay. So PR interval. This is the P wave. P wave. This normal beat from the point where P wave starts and the point where Q wave start. This is the PR interval. This is a PR interval. So the next heading of discussion is PR interval. PR interval. Normal PR interval 0.12 to 0.20 second. And one thing I forgot, this was the I told you this was the latest question. This was again the latest question in AIMS exam. Latest question means which have come in the recent exams. PR interval, this is a very frequently asked question. It's a very frequently asked question. The normal PR interval is 0.12 to 0.20 second. And if PR is more than 0.20 second, then we call as first degree heart block. We call as first degree heart block if it is more than 0.20 second, and if it is less than 0.12 second, WPW syndrome is a very frequently asked question throughout the world. So friends, we got 3 questions on PR interval. So this is our box number 3. This is our box number 3. Oh, sorry, box number 4. This is box number 4, PR interval. So now we move on to the next is QT interval. The point where PR ends and where the T ends. This is the QT interval. QT interval. So it means what? One cardiac cycle is PR plus QT is self-explanatory. I don't have to discuss this point. So the box number 5. Box number 5. One cardiac cycle is equal to PR plus QT. PR plus QT is one cardiac cycle. This is the box number 5. Okay. Now we talk about QT interval. Normal QT interval. Normal QT interval is always between 0.36 to 0.44 second. Normal QT is zoom करेंगे 0.36 to 0.44 second is the normal QT interval. Write down, just zoom it. Zoom the camera. यहाँ पे. Yeah. Normal QT is 0.36 to 0.44. Now, prolonged QT interval, that is prolonged QT. QT more than 0.44 second. This is a very, very important question. It's a very frequently asked question throughout the world. So now prolonged QT interval is seen in causes, seen in hypokalemia. This is the most important cause. Hypocalcemia, erythromycin, class 1A drug, class 1A drug, and of course class 1A drug, class 1A antiarrhythmic drug are the few of the important causes of prolonged QT interval. Then short QT interval, that means the QT interval less than 0.36 second. This is seen in hypercalcemia class 1B drug. Okay, this is the box number 6. Box number 6. So prolonged QT and the short QT interval, that is more than 0.44 second, and of course less than 0.36 second is the short QT interval. List is long, list is there, but I have discussed those which are very frequently asked causes. This QT interval. Now we move on to QRS interval. QRS interval. This is the QRS interval. Normal QRS is always less than 0.11 second. Normal QRS is always less than 0.11 second. And if it is more than 0.11 second, then we call as bundle branch block. Now, I don't need to tell to this illustrious batch that there are two types of block, right bundle branch block and the left bundle branch block. Now, how to find out in ECG that which type of block is there? Friends, if you get M pattern in V1 and W pattern in V6, if you get M pattern in V1 and W pattern in V6, we call as right bundle branch block. M in V1, W in V6 is, but if it is reverse, that means if you get W in V1, M in V6, W in V1, M in V6, left bundle branch block. This is the box number 7. This is box number 7. So we are clear about the PR interval, QT and the QRS interval. Now we talk about WPW syndrome. We talk about WPW syndrome. WPW syndrome. What we know about WP, that PR interval is less than 0.12 second, that we already have read it. In PR interval is less than 0.12 second. What else is there? You get delta wave. Delta wave. In this very frequently asked question. This is a very frequently asked question. So friends, this is the box number 8. Box number 8. So in box number 8, we talked about the PR interval and the delta wave. You made a box. Now let's learn what exactly is the delta wave. So delta wave, the PR interval is short. Okay, this short PR interval, plus you get a notch in the ascending limb of R wave, that we call as delta wave. So PR interval is short and notch in the ascending limb of R wave is delta wave. But the question, this is just to make you understand the subject, the delta wave is seen in WPW syndrome. So now we move on to hypothermia. Hypothermia. In the hypothermia, first we get bradycardia. Second, what we get is Osborne wave. This is a very frequently asked question. This is the box number 9. Osborne wave was the latest question also in this year exam. Okay, latest exam questions are Osborne wave also. This is hypothermia, very frequently asked question. Now we move on to digoxin. Digoxin. Suppose a patient come to me right now. He is in heart failure. He has rheumatic heart disease with heart failure. I do his recording, and his recording is like this. Normal recording. This is the T wave. Normal recording. And now I prescribe him 1 tablet of digoxin per day. I say you take 1 tablet of digoxin, you come back to me after say 1 month. He come back to me after 1 month and he say, doctor, I am much better. My condition is much better. I feel much improved. That so as a clinician I can understand he has been adequately digitalized. Now if I do recording, then the recording become like this. Okay, all of you just wait. You first notice, then I'll give you time to write down. So I get recording like this. In actually, I am getting ST segment depression. Okay, in actual, I am getting ST segment depression, but from ages, it has been called as reverse hockey stick sign. What is the meaning? I just first you see, hockey stick is like this. This is hockey stick, and this is like this. So they will call as reverse hockey stick sign, or this is the check mark sign. They call it reverse check mark sign. So friends, so reverse hockey stick sign, still till date they talk about reverse hockey stick sign. So now you first draw it, normal recording, and you can draw ST segment depression. But what you have to ultimate remember is digoxin is equal to reverse hockey stick sign. This is the box number 10. This is the box number 10. This is the box number 10. Reverse hockey stick sign. I hope you have drawn it. Yeah. So remember, in actually this is ST segment depression is there. Okay. I can rub it out now. Yeah. Now we talk about acute myocardial infarction. Acute MI. Acute myocardial infarction. This is the one topic which is universal question is there. It's a very frequently asked question. Throughout the world, this question comes every year in all the exams is there. So it will come to you also. So I'm leaking the paper to you, okay? But I'm doing it officially, legally, nothing illegal about it. It's a very frequently asked question. So let's see what recording we get here. This is the normal recording. This is the normal recording. This is the normal recording. Now when the acute MI occurs, the first finding is tall T wave. This is a T wave. This is a T wave. The first finding is tall T wave. Tall T wave. T wave has gone tall, and this occurs within minutes of acute MI. The first finding is tall T wave. After that, ST segment elevation. This is the ST segment has elevated. So second finding is ST elevation, and this is also known as Pardy's sign. Pardy's sign. ST elevation. And after that comes the T inversion. Look, this T wave has inverted. After that comes the T inversion. T inversion. T inversion. And the last is Q wave. This is the Q wave. T inversion this ST elevation occurs in 2 to 3 hours. 2 to 3 hours. And tall T occurs in minutes. T inversion occurs in 8 to 12 hours. And Q wave comes in 1 to 2 days. 1 to 2 days. So this is the first finding. This is the second finding. T inversion and the Q wave is the fourth finding. So friends, so we can make a box like this. Acute MI. The first finding is tall T. Second is ST elevation. Upward arrow is elevation. Third, T inversion. Down is inversion. And the fourth is Q wave. Fourth is Q wave. This is the box number 11. This is the box number 11. Okay. So in acute MI, tall T wave, ST elevation, T inversion and Q wave is the finding. Okay. I hope you have drawn it. Now we talk about potassium. Potassium is a VVIP topic. This question always comes throughout the world. Friends, whichever exam you appear in the world, Indian PGs, PLAB, MRE, etc., you always get question on potassium. Maybe hyper or hypokalemia cause, symptom or treatment or ECG finding. But at the moment, I'll talk only about ECG finding. So regarding hyperkalemia, ECG finding. The first, this is a normal recording. This is T wave. When the hyperkalemia start, the first finding is tall T wave. Tall T wave. Remember the tall T wave, the first finding. Then come the prolonged PR interval. Look, PR interval has prolonged. The next finding is prolonged PR interval. Then still more hyperkalemia, P disappears. P wave has disappeared. And this we call as atrial arrest. Why atrial arrest? Because P wave is produced due to atrial contraction, that we know it very well. Atrial contraction is there. And the last but not the least, you get wide QRS, and this is known as sine wave. Sine wave is nothing but wide QRS. So friends, you draw it. So if I have to make a box regarding hyperkalemia, the first thing is tall T wave. Then the second is prolonged PR interval. Third is atrial arrest. And the fourth is sine wave. Fourth is sine wave. This is the box number, this is 12. Box number 12. Okay. I hope you have drawn it. So now we talk about hypokalemia. 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 This is a normal recording. So once the hypokalemia start, so this is a T wave. This becomes like this. T becomes shorter and a prominent U wave appears. a prominent U wave appears. Okay. Now just hold your pen for a minute. First you see, then you draw it. In the advanced stage of hypokalemia, first of all, T disappear. Look, T has disappeared. T disappears. Look, T has disappeared. And a prominent U wave has appeared. U has appeared. Third, there is prolonged PR interval. This PR interval is prolonged. Prolonged PR interval. Prolonged PR interval. And the fourth is prolonged QT interval. QT. This is the most important finding. Prolonged QT interval. This is the most important finding. And the last but not least, there is some sagging of ST segment. Sagging of ST segment. This is the box number 13. This is the box number 13. Okay. So friends, all of you quickly go through these 13 boxes. Whatever question have come on the ECG in the last 10 years of the various exams that I was discussing, and all of the questions I have covered for you. And of course, arrhythmias I have not covered. Arrhythmia will do some other time. It's just demo class, how to study for only short time. So I hope you have drawn it. I can rub it out. Yeah. You read these 13 boxes quickly. Okay. Quickly. Then I will revise for you. Yeah. So let's see how much time we need to revise this thing. Right, sir? So I am starting with this stopwatch. I will be reading the boxes for you. Please zoom in the boxes. Okay. So I will be revising all the boxes for you, and now the time. Please focus on the watch. Yeah, it's 0. Stopwatch. Now you focus on the boxes. Yeah. So I'm starting. How to calculate heart rate? 1500 divided by number of small square between RR. All of you listen, don't speak. Tall P wave is P pulmonale, that is right atrial enlargement. Wide P wave is P mitral, that is left atrial enlargement. Regarding the PR interval, normal PR interval is 0.12 to 0.20 second. PR interval more than 0.20 is seen in first degree heart block, and PR interval less than 0.12 is seen in WPW syndrome. Box number 5, one cardiac cycle is PR plus QT. Box number 6, prolonged QT is seen in hypokalemia, hypocalcemia, erythromycin class 1A drug. Short QT interval is seen in hypercalcemia class 1B drug. M in V1, W in V6 is seen in right bundle branch block. W in V1, M in V6 is seen in left bundle branch block. In WPW syndrome, short PR less than 0.12 and delta wave is seen. hypothermia, bradycardia and Osborne wave is seen. In acute MI, in digoxin, right, this thing, hockey stick sign, reverse hockey stick sign. In acute MI, tall T wave, ST elevation, T inversion and Q wave. In hyperkalemia, tall T wave, a long PR, atrial arrest, sine wave. In hypokalemia, T disappear, U appears, prolonged PR, most prolonged QT, and sagging of the ST segment. Stop. Friends, it is just 2 minutes and 15 seconds only. Look at the board, what I have written. Zoom करेंगे यहाँ पर. Look at. I have written. Zoom करेंगे. Zoom करो. Zoom it. Show it. Closer. Yeah. So I have written that we will do in less than 3 minutes, and I have done in 2 minutes and 15 seconds. Remember, any song of any Indian movie, maybe Hindi, maybe Tamil, maybe Telugu, maybe Bengali, Punjabi, whatever, Kannada, whatever movie you talk about, each song is of minimum 3 minutes. And we have done ECG in just 2 minutes and 15 seconds. So by the time your friend sings a song and he finishes the song, you already have revised your ECG, and whatever questions have come in regarding ECG I have covered. Of course, I have not done the arrhythmia, that we'll do some other time. This is just demo class how to study. So ECG done in just 2 minutes and 15 seconds by watch I have demonstrated. Okay.